this final module, we're going to be discussing communication techniques that you can use during end-of-life care. Communication is a core skill within the nursing profession, and definitely a core skill for end-of-life care. In the past, communication skills are often seen as like this innate ability or a skill that comes naturally. Because of that idea, there are some institutions that don't teach communication skills very well or don't put a big emphasis on it, let alone communication during end-of-life care. So communication can be taught like any other nursing procedure. It takes education, knowledge, and practice, and anyone can master it. Throughout this module, I'm going to go over kind of the basics of therapeutic communication, and then I'm going to give you 3 specific tools that you can use in end-of-life care communication. So I want to discuss a couple barriers for communication in the ICU and also communication during end-of-life care. And so one of the biggest ones we see in the literature is really there's a lack of training surrounding communication during end-of-life care. There's also time limits, as I'm sure everyone's aware that's practiced in this field, and then also difficult interactions with family members due to emotional states, and then also language barriers. So through this training, we really hope to provide you with some tools to address some of these barriers. As you move forward in your nursing practice, I really want you to be able to practice using these tools and master them just like you would any other procedure. So first, I'm going to go through some very basic principles of therapeutic communication, and then I'll move on to the tools that you can use for end-of-life care. So I first wanted to talk about some of the basic principles of therapeutic communication. Some of these may look familiar. Undergraduate nursing programs tend to focus on therapeutic communication as kind of their main platform to teach communication skills to nursing students. And so some of the main topics that we see are like showing mutual respect, setting limits, allowing silence, and be clear and avoid medical jargon. So as far as showing mutual respect, some of the things that we can do are like avoiding power struggles, redirect loved ones during crisis situations, and work together with them, because really you and the family member have the best, the patient's best interests at heart. Then also it's important to set limits. Individuals during crisis can often act defensive or disruptive. It's very important during these times to be clear and avoid medical jargon. One of the best tools I like with therapeutic communication is silence. And so silence is this skill that you can have that allows the clinician to hold space. And this space really allows the people that you're interacting with to kind of think about what's going on, think about what's been stated, and process that information. It's a tool that allows reflection. All right, so the first tool that I'm going to discuss is called the nurse mnemonic. And so this is a tool that really allows the clinician to express empathy. And so the N stands for naming the emotion, the U is for understanding, R is for respect, S is for supporting, and E is for exploring. And so I'm going to give you a family statement, and then we can go through each of these letters and kind of how a nurse would rephrase that statement back to the family. And so we'll say the family said something like, "It's so hard to see my father go through this process." And so N, for naming the emotion, the nurse could state something like, "You sound frustrated," or "I understand this has been difficult for you." To show understanding, the RN can say something like, "I can only imagine how hard this is for you." If the RN wanted to show respect, they can say something like respectful statements, like, "I respect how much you've done for your family," or "You can really tell you love each other a lot, and I respect that." Another one would be a supportive statement, so the S. And so this would be something like, "I am here to support you, your family, and your loved one during this time." And then a statement to help explore feelings may include something like, "What is that like for you?" Or "What has been most difficult for you during this time?" So the next tool I'm going to talk about is Ask, Tell, Ask. Some background information on this. In one study in 2007, it was found that healthcare professionals consistently underaddress patients' and families' needs for information, while they overestimate how much they know about their condition. So to address this, clinicians must continuously check the family's understanding of, the current state of what's going on with their loved one, and same thing with the patient. When delivering information surrounding end-of-life care, it's very important for the clinician to have some sort of idea of what the family knows and what the patient knows, and it also gives you insight to be able to provide more information, like targeted information for the patient and family. So this communication tool, it's called Ask, Tell, Ask, and it's designed specifically for communication at the end of life. So the first step in this tool is Ask. This allows for the clinician to assess perceptions and understanding surrounding the illness and associated health care. The clinician can use this to establish rapport with the family while also gathering information for the next step of the tool, which is Tell. So this next step, Tell, this allows the clinician to share information with the patient and family. And again, this is targeted information based off of what you got in the Ask portion. So you can use this information to guide your discussion, and it's recommended to share no more than 3 pieces of pertinent information at a time and to not use medical jargon. So you've finished Ask, Tell, and our third step is Ask again. And so the second Ask really is used to assess for understanding of the information, and it allows the clinician to kind of gather if the family members or the patients understand the information that was given to them. This tool can be cycled as many times as needed, with additional asks and tells as needed. And really, it's something that we as nurses can do at the bedside to ensure that everyone understands the disease process and the healthcare that's surrounding their loved one during this unique time in their life. So one of the components to therapeutic communication is empathy, which is very important during end-of-life care. It's imperative for clinicians to show empathy during end-of-life care, to communicate in non-judgmental ways, and then also encourage individuals to talk about what they're going through. Remember, this is a very unique and difficult time for patients and loved ones. So sometimes part of our job is to extrapolate information from them. And this can be done through a tool, it's a very simple tool called Tell Me More. And it's exactly that. It's just you asking your person that you're communicating with, tell me more. Can you tell me more about how you're feeling right now? Or can you tell me more about what you know about your father's condition? And so really there are a couple different levels for Tell Me More, and that's facts, emotions, and meanings. So like a factual Tell Me More would be one that I already stated. It was like, tell me more about your father's condition. And that allows you to get an understanding of what this loved one knows about their patient or their father's condition, and you can give them facts with that. Another one is emotion, and that would be something like, well, how do you feel about your loved one's condition right now? And then they can tell you more about it. And then the last one is meaning, and this is the most deep tell me more that you could do with someone. And so oftentimes it would be like, what does your father's death mean to you moving forward? Nurses are an essential team member when it comes to end-of-life care. And so one of the roles that we play is communicating the patient's and family's needs to the whole healthcare team, because we're the ones at the bedsides, and things change from moment to moment. So it's really important to be able to have communication skills and tools to communicate the patient's and family's needs with the interdisciplinary tool. And so after you've done the ask, tell, ask, oftentimes you have new information that you'd like to share with the interdisciplinary team. This may seem familiar. Oftentimes SBAR is used in handoff reports between nurses. And so SBAR, it stands for Situation, Background, Assessment, and Recommendations. It was originally developed in military and aviation use, and we've taken a lot of things from military and aviation, including the SBAR tool. I believe that Kaiser Permanente was one of the first healthcare facilities to take this and put it into clinical practice. There isn't a lot of research on using this in end-of-life care, but it is recommended to use this tool to communicate with the healthcare team in general. So just a brief overview of this, because this is probably something that's familiar to you. So the S stands for situation. This is for you to describe your concern and the situation that's surrounding whatever it is that you want to communicate with the interdisciplinary team. B is for background. This is where you kind of describe the case history. For example, who, what, where, and why. And then for assessment, which is the A, this is where you inform the team of your findings. Limit this to the essential. And then R for recommendation. That's when you explain what you need or what you would recommend for this patient's condition or this family's condition. We as nurses are very lucky to be in the profession that we are in. We are able to practice these skills daily when we talk to our patients. And it's almost like it's becoming a lost skill, communication, because we have so many devices and technology now that we talk through. But as a bedside nurse, you still have to communicate with patients, their families, and the interdisciplinary team. It is essential for you to be able to perform this skill, to be able to perform your job. And really, this is a time when you can advocate for your patients and learn more. I feel very lucky to be able to be in a profession when we are still so reliant on face-to-face communication, and it allows you to build bonds with people and these really interesting relationships that we don't get in other experiences. And so I really wanted to leave you with the idea that communication is like any other procedure, and it takes practice. And you guys have the opportunity to practice in almost every clinical scenario. And so next time you go to work or next time you're communicating with, it could be anyone, a teacher, a loved one, or a patient at work, try and use these tools and just see how it goes. At first they come off a little awkward and cumbersome, just like the first time you were putting in an IV or a Foley catheter. But with time, you're going to get better, and the techniques will seem more smooth, and you'll be able to do more for your patients. This really is a special tool to be able to have. So on that note, I want to leave you with a quote by Jim Rome, an entrepreneur. And so it's, take advantage of every opportunity to practice your communication skills so that when important occasions arise, you'll have the gift, the style, the sharpness, the clarity, and the emotions to affect other people.